Hi everyone, in this video we are going to study about secondary dysmenorrhea. In the chapter of dysmenorrhea and disorders of menstrual cycle, this will be the fourth video. In the previous videos we have read about primary dysmenorrhea, membranous dysmenorrhea, differentiation, primary dysmenorrhea, management protocol of primary dysmenorrhea. Now let us move on to secondary dysmenorrhea. Secondary dysmenorrhea, the other name is congestive dysmenorrhea, is normally considered to be menstruation associated pain occurring in the presence of pelvic pathology. The main differentiation for primary and secondary will be, in secondary there will be pelvic pathology along with the menstrual pain. In the primary, no pelvic pathology. Causes: the pain may be related due to increasing tension in the pelvic tissues. There will be increased tension in the pelvic tissues due to premenstrual pelvic congestion or increased vascularity in the pelvic organs. When the blood supply is more, when the increased vascularity of the pelvic muscles, there will be tension in the pelvic tissues. That could be a cause for the congestive dysmenorrhea. The pelvic pathologies will be as follows: endometriosis, adenomyosis, pelvic adhesions, uterine fibroid, endometrial polyp, pelvic congestion, IUCD in utero, obstruction due to Mullerian anomalies like the uterus. If there are Mullerian anomalies, the abnormalities in the cornua of the uterus, or there is a septate uterus and everything, if there is obstruction due to the Mullerian anomalies. Cervical stenosis narrowing, if there is a cervical stenosis, chronic pelvic infection, then these could be the causes for the congestive dysmenorrhea. Hope it is clear. Endometriosis, adenomyosis, the adhesions you can next you can remember them as a fibroid, polyp, uterine fibroid, endometrial polyp, pelvic adhesions, pelvic congestion. Then IUCD in utero. IUCDs are nothing but intrauterine contraceptive devices. If they are being injected in uterus, it could also be a cause for the pain during the menses. Secondary dysmenorrhea, it is also the menstrual pain with pelvic pathology. The pelvic pathology could be the IUCD. Then obstruction and cervical stenosis, chronic pelvic infection. When you see the patient who is suffering with the congestive dysmenorrhea, she will be usually in her 30s. She will be a Paris woman and unrelated to any social status. It can occur in the poor, it can occur in the rich. It did not have any social status, like it is found morely in the poor, like lower economic status. It is not as such. Any woman can suffer from secondary dysmenorrhea. She will be in her 30s and she will be a Paris woman, which means she is already conceived. Clinical features: the pain is dull, situated in the back and without any radiation. Like in the primary menorrhea, the pain was in the lower abdomen and it was radiating to the medial aspect of the thigh. But here there is no radiation, and there was dull achy pain, and it is situated in the back. It usually appears 3 to 5 days prior to the period and relieves with the onset of bleeding. Secondary dysmenorrhea, 3 to 5 days prior. If your menses is on the 5th of the month, it occurs 3 to 5 days prior. It starts from 1st of the month. The pain will start from 1st and then it will stay till 5th. Once you get your menses on the 5th, it relieves. The pain relieves. There is no systemic discomfort. Systemic discomfort in the sense like nausea, vomiting, diarrhea, tachycardia, all such symptoms won't be present in secondary dysmenorrhea. Unlike primary dysmenorrhea, which means in primary dysmenorrhea, all these symptoms will be present. The patient may have got some discomfort even in between periods. The intermenstrual period between one cycle to other cycle, that period the patient will have some discomfort. Abdominal and vaginal examination usually reveals the pathology. You know very well from the start that primary dysmenorrhea, no pelvic pathology. Secondary dysmenorrhea, pelvic pathology. So when you do the vaginal examination or abdominal examination, it is obvious that you are going to reveal a pathology inside. Hope congestive dysmenorrhea is clear to you guys. What you need to remember in this is there will be pelvic pathology. The causes of the pelvic pathologies, the names you need to remember: endometriosis, adenomyosis, uterine adhesions, it could be polyp, uterine fibroid, and stenosis could happen, and IUCD could be a reason, pelvic infections could be a reason. Then the woman will be in her 30s, she'll be a Paris woman. Clinical features you need to write: how is the pain? It is dull achy, it is in the lower back, and there is no radiation, no systemic discomfort, and some discomfort, and only some discomfort might be present between the period. And vaginal examination will reveal the pathology. Some discomfort in the sense there might be white discharge or something like that, but no nausea, vomiting. Systemic discomfort won't be there. Hope it is clear. In the next video, we are going to study about premenstrual tension and ovarian dysmenorrhea and so on.